Welcome to this webinar. I'm Beatrice Clopa. I'm the founder and clinical director of Enoia Therapy Self Development. And this short webinar is just to share a little bit about how to cope with COVID-19 and practice safety. During this time, I've invited Dr. Lillian West with Bear Fruit Direct Primary Care to share a little bit with us from a medical perspective about coping and practicing safety with COVID-19. And right now, I'll just turn it over real quick to Dr. West to share with us a little bit, about herself.
Good morning. I'm Dr. Lillian West. I'm an internal medicine physician and co-owner of Bear Fruit Direct Primary Care Clinic here in Little Rock, Arkansas. Thank you for having me.
Yes. Thank you so much, Dr. West, for joining me. So we're going to jump straight in, and I'm going to ask you, I just want to ask you a few questions about how we can practice safety and coping with social distancing during this pandemic. So the first question that I'll ask you is, is it still safe to go outside?
Sure, absolutely. So that's a great question, actually. Given the course of this pandemic, it is important that patients take into consideration the importance of the social distancing. And with that being said, is if you can abide by the CDC guidelines, staying 6 feet, at least 6 feet away from another person, as well as the universal masking that's just come out, that can reduce the spread of this virus. Ideally, in a great situation or environment, or the way things used to be, exercise outside, running, getting sunlight, fresh air, that's ideal. And it still is to a degree if you can be in a less populated area where you're not going to be around a lot of congregated crowds. And so with the summer and spring approaching, more and more people want to get outside. However, with this virus that is deadly, it is important to use wisdom. And when you're in an environment where there is a lot of people, you should go home. You should go home. And there are things you can do online. There's YouTube. There are exercises you can do at your home, videotapes, that you can still get that exercise in. And this too shall pass. But while it is important to get that exercise and to enjoy the sunlight and the freshness of the day, it is equally important to stay safe for you, your community, and your loved ones. And so that's why I'd recommend staying home as much as possible. That is the aspect of social distancing. Right. And so, yes, it can be overwhelming watching a lot of the news because of what it's going to portray. And it is portraying a lot of truth about what's going on in many parts of the country and the world. What is important to know is that contracting COVID-19 for majority is not a death sentence. People do recover. However, the people that we find that are most infected are those in the age ranges of 19 to 64, if you've been kind of watching the reports, right? So there's no real predilection. There are people still being intubated, being hospitalized because of the shortness of breath. We know that the mortality is higher in our patients that are older than 65, So to ease the original question, to ease the anxiety, I would say if you had to cut off the news, find maybe a hobby or a gift that you have that you can work on during the downtime that you may have at home. Also, just try to remember what you are thankful for. Okay, so that's important too, remembering what you're thankful for, and making maybe a virtual date with your friends online. That's something you might be able to do to continue to social distance.
Okay, those are all really great ideas that I think most of us are trying to, at least cope with to some degree by doing these virtual happy hours. Those are but after a while they'll get old. But that's fine. So the next question that I wanted to ask are, what are some symptoms that we should look for I know a lot of people are suffering with allergies. We're fresh into spring, and even when I came to see you, I was like, my allergies are just flared up. This was even before COVID-19 was a thing, right? So even now, people are wondering, is this my allergies or are these symptoms of COVID-19? What would you say to that?
Yes. And so I definitely would say you definitely want to be vigilant because, again, there is a large amount of patients or people that are asymptomatic, and they may think that it's just their allergies that are going on, and it could potentially be this virus. And so if you're experiencing any of those symptoms, whether it be cough, it feels like sinus, or cold symptoms, because coronavirus originally is in the family of the common cold virus. It's just that our bodies have not been introduced to this particular virus, this strain, I should say. And so the priority, and given that a lot of patients aren't tested because they may not be priority, i.e., the age or or comorbid conditions. It is important that they stay home or you stay home when you have those symptoms of cold, or even you think they may be allergy. It could very well be the virus. And stay in touch with your doctor. Contact your physician and speak to them about your concerns and what you feel, and that way you'll have a follow-up, so you can follow your symptoms, and if they progress, you have that person to help guide you.
Awesome. Those are really, really great tips, Dr. West. Thank you so much. There's one final question that I wanted to ask you, that I wanted to see if you can speak to.
Okay.
And I would, the news came out yesterday, talking about, African Americans being at higher risk for dying from COVID-19. Can you speak to that a little bit and give us some clarity about, just your perspective on that?
Okay. So yes, that is a great question. Well, there is data, of course, that the population of African Americans are underinsured and may not have adequate access to health care. And so there may be underlying comorbid conditions like hypertension or diabetes that, some patients may not be aware that they have. And we know that having these conditions put patients at higher risk for the illness. And not just that, too, there may be some socioeconomic component. And so if we have patients who have to go to work, because they need that to live, right? Those basic things to live, then there may be exposure to the virus as opposed to staying home, like some of the recommendations suggest. That may be why there is some disparities that are noted with this disease.
Yeah, thank you so much for touching on that. Dr. West, can you share with those who are viewing, how can they reach you? Because right now, I think a lot of people are thinking about what they can cut back on, right? But having medical care is not one of those things right now that we're going to cut back on, right? If anything, people are probably buying more coverage or whatever the case might be. How can they reach you? How can they connect with you if they want to talk through these symptoms, or they just, they want to be able to have someone to connect with? How can they reach?
Absolutely. So we can be reached by phone at 301-4607. We're located at 8221 Ranch Boulevard, Suite 2. At this time, given the pandemic, we are doing virtual consultations and visits, and as well as those patients who need primary care doctors. What's unique about our practice is that that's inclusive, the virtual visits, and patients can text us, they can email us, and they have same day and next day appointments where they can reach their doctor, and we can talk to them and discuss their concerns and follow them. We follow them daily with their concerns if they have symptoms that were concerning. And so, that's how, we're available. Me and my partner, Dr. Pendleton, again, I'm an internal medicine physician, and Dr. Pendleton is family medicine, so she sees ages 2 and up, and I'll see ages 17 and older.
Awesome. Okay, so you all can take care of the entire family.
Yes, we.
Perfect. And then you all are doing the virtual consultations, which is great. What about testing for COVID-19?
Yes, and so that's a great question. Based on the current guidelines, and we have some PPE that is arriving, set to arrive, we will be able to do COVID-19 testing for our patients who meet those guidelines and the recommendations as set forth by the CDC.
Perfect. So when you all are set up and ready to go with doing COVID-19 testing, how can they keep up to date with that? Can they visit your Facebook? Would you have a post, or how can they be notified when you will be a facility that will be doing the testing?
Absolutely, great question. So we will update that on our Facebook page, and we can update that also on our website, www.barefruitdpc.com. That's you can go to our website and find out more information about our practice style. Again, we're here and we're available for those patients who may be in between jobs, those who have high deductible plans, those who are insured or underinsured and just need good primary care. We're available.
Thank you so much, Dr. West. I really, really appreciate you